Hey, Jason Tuschman back here with episode 73 of Spot On Patient Acquisition. Today we're going to go through our 2019 practice marketing checklist. So, first thing we want to do is we want to audit 2018 results versus 2017 results. We don't like to look back too often, but when you're planning for an annual calendar, you definitely want to do that. Let's first understand how many new patients did we acquire, both in units, the number of new patients, and how much money did we make from them. Let's also understand the same thing for existing patients. Then we want to go in and look at the sources of traffic. How did we do with the marketing channels that we utilized? Look at your website traffic. Is your organic traffic up or down year over year? How does it look on the important pages to you as a practice? Look at your social media, your Instagram, your Facebook, the number of subscribers, the amount of engagement that you've had per post. Make sure you understand these things, analyze them, and see if you see any trends, either positive or negative, with what you're doing. Then also look at the referrals. How many referrals did you get in from former patients, prior patients, perhaps other practices? Understand your referral sources as well, and look at all of this against 2017 so you understand where you improved and where you didn't. From there, what you want to do is establish your 2019 revenue goals. Now, as we've talked about media planning before, your revenue goals ultimately have to correlate to what you want to do as a person and how you want to run your life with the practice. Are you somebody that wants to work to live to work? What's your choice? And make sure that your goals are correlating to that personal belief. First thing, how many new patients are needed to hit your revenue goals? How many existing patients are needed to hit your revenue goals? Now, that's a sliding slope based on how you want to run your marketing and how you want to run your practice. Then you've got to put together a media plan. As we've discussed before, your media plan should be integrated, okay? It should involve all the channels available to you. It should be done on a month-to-month basis, and you should look out at least 6 months in advance and understand where you're headed. So make sure that you've got your web, your social, and your retention marketing with your practice in regards to events and emails figured out in that plan, planned out at least 6 months in advance, and make sure you've got everybody on board with where you're headed. Then from there, make sure that your team is set up, okay? Make sure your team understands, your office manager, your front desk personnel, patient coordinators. What are their responsibilities in regards to hitting these goals? What are the responsibilities with respects to the metrics that are going to hit these goals? And what are the tools and resources you're willing to give them and that they need in order to successfully implement this goal? If you use this as a basic checklist, I guarantee you'll do better next year than you did this year. Hope this helps you, and we look forward to seeing you next time.